Spasticity is a tightness or resistance in muscles that hampers movement, and it is often most active when the child is trying to be most active. An example would be a child with spastic diplegic cerebral palsy, where they will have tightness of their hip adductors, their hamstrings, and their calf muscles. And so when they try to walk, it forces them into a pattern where they're up on their toes, they're crouched, and they're scissoring. And especially early on, where they're just trying to learn how to stand, these movement patterns can really inhibit attainment of milestones. So some of the treatments I might do, I might try to treat them with medication, and we have a fair number of medications at our disposal to try to decrease tone, which works well when the tone is overall through the whole body. But sometimes you have tone, as I was describing, in focal areas where it might be just child's calves are really tight, which puts them up on their toes and affects their balance. In that case, I might do injections of Botox to block the signal between the nerve and the muscle and to get those muscles to relax, in which case the child will find it easier to get flat down on their heels. I think other advances, one that has made a huge difference in our patient population, I think, has been the intrathecal baclofen pumps. I was talking about the medications before that are being given systemically. Some of the limiting factors with that are the side effects that you get from these medications. Often I can give someone enough medication to decrease their tone, but often that makes them sedated and decreases the function. So with this intrathecal system, you are delivering a much smaller amount of medication, but that catheter delivers it right to the spine, right to the site that the medication is working. So you avoid a lot of the side effects and get a lot of the benefits of the tone management. The process involved with the baclofen pumps is, if I identify a patient who is appropriate for this treatment, I'll do a test dose of the medication, which is a lumbar puncture. We'll put in a small amount of the medication, and then I will observe the patient along with one of our physical therapists who has also seen the patient at their baseline. And we observe them at 2 hours and at 4 hours, and the parents are there the whole time, and they can see the changes. So you get both objective and subjective changes that occur in the course of a day. And then together as a team, we make a decision whether this is something that's going to be beneficial for the child. If that's the case, I'll go on to refer to our neurosurgeon, who then implants the pump, which is typically, they often go home the next day. Most of the time they'll go home the next day with this pump. And then I see them back in clinic, and without putting in a needle, without anything, I have a little programmer that can communicate with the pump via radio, and I can make changes, dose adjustments, increase the dose, decrease the dose, put them on a fluctuating dose where they might have worse tone in the morning, so the medication is delivered more in the morning than in the evening. And then they go on with that, and they can resume most of their regular activities. There's very few limitations with the pumps.